Hi, I'm Stacy Dove, and I'm the Director of Community Engagement for Drawn from Valor. And today I am with Dr. Heather Yardley, who is a pediatric psychologist at Nationwide Children's Hospital. Hi, Heather, how are you?
I'm well. How are you?
I'm great, thanks. So Heather is one of our subject matter experts for Drawn from Valor. And would you mind telling us a little bit about how you work with Drawn from Valor and what it is that you do to help us create the animations and resources that we provide for kids and families?
I'd be happy to. I've been able to do a couple of different really interesting things with Drawn from Valor. First, at the very beginning of a project, Todd and the team have reached out just to kind of get some information, generally speaking, about the subject matter or the topic and what might be interesting and relevant for kids and families. And then they've kind of gone back and started working on the stories and the animation. And then as the script is developed, the team reaches out to me and other professionals to see how that information is being presented, what words to use, what different themes to reflect. The most recent one, Anya's Prize, we were talking about how the siblings were interacting and making sure that that seemed like real sibling interaction. So they really have an eye towards making things very applicable and meaningful and psychologically sound in terms of making sure we're not causing any additional distress, addressing the issues that kids and families might have in a very developmentally appropriate way. And then I've been fortunate to be able to watch different versions of the animation and continue to give feedback in that way.
That's super fun.
It is really fun.
We're living in a really interesting time right now with COVID-19 and all of the measures that we're taking to be safe. Are there resources that you would recommend for parents and their kids to help safeguard their mental health, or maybe even to help keep an uplifting environment at home during all of this?
For sure. I think one of the things that for families to reach out and be able to do is any of their children's hospitals or mental health providers in their area, lots of us are offering like online services. So if it gets to a level where you maybe need some direct support, you can reach out and have a session with a therapist or a counselor and get some advice that way. And also all of the different hospital programs are working on developing some materials. So like our hospital has lots of tips and tricks on keeping a routine and making sure that you are taking some time for yourself, letting yourself off the hook a little bit. Drawn from Valor is working on some resources that will be out very soon in May that I was able to help consult on. So there's lots of resources. I think in terms of like websites, American Academy of Pediatrics has some good materials out. There is a division of APA, which is the American Psychological Association, focused on children. That's Division 54, Society of Pediatric Psychology. They have some resources available on their website also.
Wonderful. As a pediatric psychologist, what are some things that you wish people asked? What are questions that you wish people asked when they first come to you?
I think one of the things that people should ask that I don't often get asked is just questions about me. Therapy is kind of a weird thing and it is a little one-sided, and it should be, but I think it's also good for clients to know a little bit about their therapist so that they can make sure that they're getting a good fit. So asking some just general questions. I think they should also ask about what therapy is going to be like so that the therapist has an opportunity to explain that they'll be doing so that there are some good expectations up front.
I've been asked to see if you have a 1-minute breathing or relaxation exercise that kids and or their parents can perform at home when you're feeling stress, because we're all feeling a little bit more stress right now than I think we normally are. Is there something that you have or a tool that we could all keep in our back pocket that would be helpful?
For sure. I think one of my favorites is a mindfulness activity, and we call it the 5, 4, 3, 2, 1. And so it's really a grounding technique where you look for 5 things you can see. So like in my office, I see my table, a chair, a notebook, the computer, and a pen. 4 things you can hear. There's nobody up here, so I can't really hear very much, but like listening for the wind or other sounds. 3 things you can feel. So what are 3 things you can feel. So like I can feel the chair, I feel my sweatshirt, I feel a little chilly because my office is cold. 2 things that you smell. So that really helps with deep breathing. So like smelling. So in my office, I keep a diffuser. So I smell mint and rosemary, and then just kind of hospital air because I'm at the hospital. And then one thing that you can taste. So whatever last that maybe was in your mouth, or that maybe is a good cue to have some gum and chewing some gum. So I think really going through your 5 senses, and you can mix them up in whatever order you like, but going through that 5, 4, 3, 2, 1 really helps bring you back into the moment for a few minutes and gets you out of your head because it's a little bit active.
Yes, that's fantastic. And that's something that we can all do, adults and kids.
For sure, at any time. And no one can see that you're doing it. And it just takes a second. So it's not like you have to pause and get out of your routine for a long time.
Right. That's fantastic. Thank you.
Mm-hmm.
And I guess the last question that I have for you is, since May is Mental Health Awareness Month,
Mm-hmm.
are there any things that you think that we should all be especially mindful of right now as we go through Mental Health Awareness Month?
For sure. I mean, I think everybody's mental health is a little bit extra challenged right now. We're losing lots of our resources and our outlets. So I think the first thing is paying attention to what you need and asking for what you need. So if you are typically a social person and you can't be very social right now, looking for ways to meet that need, doing Zoom, doing phone calls, whatever that is. I think giving ourselves a break too, like to remember we're kind of all really in this together and it's very stressful for everyone. So it's okay to not be okay. And it's okay to do what you need right now. I hear a lot of my patients and families that I work with thinking about like all of those like Pinteresty ideas, like we have to learn new things and do everything and homeschool is perfect. And that's just not life. So I think making it through the day and doing okay is the best thing that we can do. And then I always like to say, just bearing in mind that mental health is health. So if you're having a concern, it's just like any other concern that you might have, like a broken leg or a cold, getting help if you need help. It's just part of your overall health.
Great. Thank you so much for your time today.
Sure. Happy to do it.
Great.